Hi, and welcome to another episode of the Healing Lyme 2.0 Summit. Today, we're going to be talking about protecting your family from ticks and tick-borne disease. Specifically, we're going to talk about regional risks, prevention tips, and we're also going to dispel some common myths related to Lyme and co-infections. Here with us to navigate through all of this is my very good friend and colleague, Dr. Alexis Chesney. Dr. Chesney is a naturopathic physician, acupuncturist, and author, as well as an educator specializing in Lyme and vector-borne disease. Dr. Chesney thoroughly enjoys getting to the root cause of complex chronic illnesses and partnering with her patients to find wellness and balance in their lives. Welcome, Dr. Chesney. Tell our listeners a little bit more about yourself and how you came to specialize in treating vector-borne diseases.
Thank you so much for having me, Dr. Henchy. It's great to be here. Love talking about prevention, preventing Lyme in the first place. I'm very passionate about that. I think it all really goes back to my grandmother. I often talk about how a friend of mine in medical school had Lyme. And that is true that that was a difficult journey. But really growing up with my grandmother who had strep as an 8-year-old before penicillin, and sort of like the classic pandas, right? Had rheumatoid arthritis and aches and pains and fatigue and lots of medications when I got to know her. And she was so dear to me. I always thought, what else can be done for her? I always wonder, what if there was a naturopath or an herbalist who could have helped her when she was 8 years old, Luckily, she had a valve replacement, so that got her a few more years, which was wonderful. But yeah, it's kind of interesting thinking about strep or Lyme or other pathogens and how this can create such long-term chronic issues for patients. And I think that's what my calling is, really to kind of guide those patients on their journeys of healing.
Awesome. Thank you for sharing that. So tell us how did you become specifically invested in treating Lyme and vector-borne disease? So we know, with your grandmother and all of the, with the strep issues and how they can lead to various immune dysfunction, but like, how did you actually settle into treating Lyme?
Yeah, well, I was very, very lucky to stumble across Dr. Richard Horowitz, and he wasn't too far from me. I did an internship, and then this was during my residency in southern Vermont. And so he said, "Oh, there's lots of Lyme in Vermont." And I thought, well, there probably is some, but coming from New York and Connecticut, I certainly knew there was a lot in those areas. And I really had no idea that I was on the front line of Lyme in Upper New England. And so, yeah, that's what happened. I thought I was going to be doing primary care, and really it turned into just seeing patient after patient of undiagnosed, misdiagnosed Lyme. People said, there aren't even any ticks in Vermont. Oh my God. It's just terrible.
Right.
Someone would walk in with a tick bite and have no idea what to do.
Yeah.
And clearly there are ticks, and the incidence for Lyme has been highest in those states, since 2010. So
Yeah. And also, for listeners that don't necessarily know what naturopathic medicine is, like when we are trained in school, we're really trained to get to the root or underlying cause of someone's illness. I think a lot of people think that naturopathic doctors just use, herbs or supplements or natural medicines as opposed to prescriptions. But I think it's the whole like philosophy, like the functional medicine piece of actually figuring out what is happening in that patient and directing the treatment there. And, oftentimes it is, a vector-borne disease or some sort of stealth infection that has never been properly diagnosed.
absolutely, I saw that all the time. And, these diagnoses like chronic fatigue syndrome and fibromyalgia, it's like we want to get to, well, what is causing this? There's a cause for this.
Right.
Yeah.
Okay, so diving more into the prevention. So obviously, tick identification and knowing what the various tick populations can carry is very important in the scheme of prevention. So, can you tell us a little bit about the different tick populations and the diseases that they carry across different regions?
Yes, I think this is super important because then we know if someone had a tick bite and if we can identify which tick it is, then we know what pathogens that tick might be carrying and therefore what diseases might manifest. And so, of course, we're in New England, we're used to the black-legged tick, the deer tick, which carries Lyme or can carry Lyme, right, which is Borrelia burgdorferi, or out in north central states, that would be Borrelia mayeni as well, can be a cause of Lyme disease. Um, Babesia, Anaplasma, Powassan, Borrelia miyamotoi. So that is commonly what's discussed because so much of these diseases occur in the Northeast. But we do actually have Lone Star ticks that have made their way up into New York and Connecticut, and now even we're seeing them in northern New England. And it's really important to note that they carry a batch of different pathogens, right? And so the Lone Star tick can carry Ehrlichia and something that causes star eye, southern tick associated rash illness, which is a little mysterious. We won't go into it, but it's thought of to be a Borrelia species, which would be a Lyme-like causing species of pathogen. But there's no 100% consensus on this, which is kind of crazy. I hope that we can really get there so we know what that is. And also, I think more people are getting to hear about alpha-gal syndrome, and that is transmitted by the saliva in the Lone Star tick. So it's not a pathogen, but it's well, I'm sure other people will be talking about that, which is really important. But so a whole different host of illnesses that you can acquire from a Lone Star tick. And then out west, we have the Rocky Mountain wood tick, which of course carries Rocky Mountain spotted fever. Down south, we also have the Gulf Coast tick, which can carry a rickettsia species. And then the Western black-legged tick out west is very similar to our black-legged tick, which carries similar species. But yeah, I think it's important when you travel. Also, there are these soft ticks called ornithodoros. They carry Borrelia species like Borrelia hermsii or turicate, and those attach to you, the ticks attach to you at night, overnight, and they can transmit those infections in 15 seconds. So
Wow.
this is usually when you're outdoors in like an old cabin, or if you're somebody who explores caves and you're really in the outdoors. But in southern United States and a little bit of western United States, we find these ticks, and I think this is really important to know about them and what they carry as well. So
Yeah.
it's a
And
little
I think
glimpse into all the ticks in
yeah,
the
and no
United
matter
States.
what, it is just so important to get your tick tested, right? Save the tick, send it out to a reputable company, and actually have the tick tested so that you know what type of tick it is. And also so you know what pathogens you could have possibly contracted from it. And then you can, take appropriate preventative measures to stop yourself from hopefully getting the infection.
Exactly.
Um, Now, you brought up a good point, right? So, if anyone goes to Dr. Google, right, and looks up how long it takes to transmit any of these infections, most places are going to say that you only have to worry if the tick has been attached for 24 hours or more. And this is such misleading and false information. Can you elaborate a little bit more about how quickly various ticks can transmit the various infections? Because I know it's different for many of them.
Right, right. So we talked about that scary 15 seconds for Borrelia species, and that's species that cause tick-borne relapsing fever from those soft ticks, the ornithodoros. They're very special. That you
Mm.
don't come across those every day, we must say, right?
Yeah,
But
yeah.
important to know about. So going back to something more common, like the black-legged deer tick in the Northeast or out west. So those, um, of course, with Lyme, the main pathogen of concern, there's sort of a bell curve, right? So it was identified that there was transmission as little as 4 hours. Now, that doesn't usually happen, but I think it's important to acknowledge that it has, right? So
Hmm.
usually they're seeing more like 12 or 24 hours for transmission. And yes, sometimes it can take even longer for transmission to happen. So we've got that bell curve. I just think it's important to be aware of that. And also, about 10% of the ticks that are out there have already started feeding. And when a partially fed tick attaches to another human and is sort of primed, right? So they've started that blood meal process of feeding. Now, time has gone by where the pathogens may have already moved into the saliva. And so when that's what needs to happen for transmission to occur, moving those pathogens in the saliva into the human. And so about 10% of those ticks are going to transmit um, Lyme within 24 hours. So, or I'm saying this wrong. So 10% of the ticks out there are our cohort that I'm talking about, right? 80 to 100% of them will have transmitted Lyme within 24 hours. So I think that's super important to understand as well, right? Just how quickly this can happen.
Yep. And to further explain to the listeners, so like basically the spirochetes, which are the type of bacteria that cause Lyme, they live in what's called the hindgut. And so when the tick starts feeding and starts taking in a blood meal from whatever it's bit, a human or a mouse or whatever, that blood meal coming in mobilizes the spirochetes to the salivary glands. And that's the part that can take several hours. So, like, if the tick has been feeding on a mouse for, let's say, 20 hours, and then the mouse scratches it off, and then the tick crawls over and gets onto you, it already will have had the spirochetes mobilized to the salivary glands. And then when it attaches to you, when it bites you, transmission can happen very rapidly because the pathogens are already there in the saliva. And so it's kind of like, that 24-hour period that could have happened on a different animal, like the mouse, for example.
Sure, absolutely.
But go ahead because, right, the Powassan virus is very quick and go through some of the other.
Yeah. So anaplasma takes 12 hours. I think that's important. We see a lot of anaplasma in the Northeast. And Powassan's very quick. So that's 15 minutes. So that's scary. Thank goodness it's pretty rare. But
Mhm.
in some areas, I mean, there was a study out in Massachusetts showing that a small area had like 70% or more of those ticks had Powassan. So there are, and there was a similar area in Pennsylvania. So there are these kind of like pockets of areas where black-legged ticks actually have a higher infection rate of Powassan.
Yeah. So, what are the most effective strategies, in your opinion, that people can take to protect themselves and their families from even getting a tick bite in the first place, especially if they live in a high risk area?
Yeah, so I always like to engage my patients in seeing where they're at, right? Because I have some patients that really don't do much at all, and some who are doing all of it, right? And so meeting them where they're at, if you're not doing tick checks, please start doing tick checks, and really spend some time. Spend time in those hard to find places, those moist, dark, warm areas, because those are the areas that the ticks like to go to. But a lot of us are doing that already, right? So let's take it a step further. I really recommend using permethrin treatment for shoes and socks because just doing that will decrease the chances of a tick bite by 73 times. So that's pretty remarkable. If you want to go beyond that, you can certainly think about doing clothing and materials like you can do a blanket if you do want to do a picnic, or if you're somebody who's really working out outdoors and have some backpacks or tents or materials, then please, spray those down with permethrin. Now, just to note, please be careful. When permethrin is wet, it is toxic to our skin. Once it is dried, it is very well bound into the material and will not harm us. So, and it will continue to reflect it will continue to um, repel ticks. So I really like utilizing that permethrin on some workers in North Carolina. It was actually shown that it decreased the chances of a tick bite by 99% when you had
Wow.
the workers that were, in permethrin treated clothing. So I work
Yeah.
with a lot of loggers and farmers and people that are just outdoors all the time. So also I think it's important to match your level of being outdoors and with what we're using. We do want to acknowledge that just walking across your front lawn, there may be a
Mm-hmm.
tick there, even if you keep that lawn short, which is helpful, but it's not going to deter ticks 100%. So doing the socks and shoes, I think for like an everyday person, is a great first step. But if you're a gardener, and you're kneeling in the garden, you may want to do the pants, the shirt, and have, I always had, a set of clothing that was like my gardening clothes, that I had sent out. And you can send out clothes to a place called Insect Shield, which is really awesome. So you can do certain things yourself. If you do it yourself, you need to retreat every 6 weeks. If you send it out to a place like Insect Shield and they commercially treat your clothing, it lasts 70 washes. So a long time. So
Yeah, it's a
combination
long
of these
time.
things. And then of course there are repellents that are safe for our skin. I love cedar side, using
Yeah.
cedar essential oil. But then we need to remember to apply, to reapply very often. So every 1 to 2 hours, that's the efficacy.
Right.
There's DEET, there's Picardin, um, a lot of options. I think using a combination of the permethrin treated clothing with some repellents, with tick checks, and then also putting your clothes into the dryer for 5 minutes after you come in from the outdoors. I think all these things in combination can be really, really useful.
Yeah. I think for the effectiveness even of each of those individually, if you combine them all together and then do tick checks, I mean, you can do a really good job of decreasing your risk of exposure or being able to find it immediately and deal with it. I have one
Right.
question. So this always pops into my head. So I would imagine it's popped into at least a few of our listeners. So, like, if you have the socks that are treated, and let's say you treat them yourself, and then your body starts to sweat or your feet starts to sweat, there's no risk of that being then absorbed through the skin. Or do you recommend, or do you personally put another pair of socks like in between those socks and the skin? Just curious.
Yeah, well, apparently it's very tightly bound with the material, so it needs
Okay.
agitation to be released. So something
Okay.
like the washing machine. Yes, when you put it into the washing machine, it will be released to some degree.
Okay.
But
But not
walking through a
onto
puddle,
your
getting
skin.
rained on, or sweat, is not supposed to be able to release that onto us.
Okay. All right. Great.
Yeah, yeah.
So, staying in the mode of prevention, we had a study that was done several years ago showing that a single dose of doxycycline can prevent Lyme disease and other tick-borne illnesses. Can you comment as to why that is not true and typically is not enough after a tick bite to prevent any of these infections?
Yeah. So, I mean, I always say for my patients, if they really want to take a dose of Doxy, they certainly can, right? But I'm going to talk about a lot beyond that. So
Hmm.
ILAD's guidelines recommend 20 days of Doxy. And I talk a lot about using herbal medicine when we're in that stage of watching for symptoms, when somebody's asymptomatic, before any symptoms might come up. But yes, this is what often is given or recommended to patients when they see a conventional medical provider, the doxycycline single dose. And so this study is just it's really flawed, unfortunately. It'd be great. Like I remember years ago when I finally dug out the study and read and I thought, oh, this is so disappointing. This would be awesome, right? If it
Yeah.
was this easy. Um, so yeah, so different things like it only showed that 87% of the Lyme rash, the erythema migrans, resolved with the single dose doxy. So a few things, right? The rash is always going to resolve. And that it
Hmm.
didn't resolve in all the cases is kind of awful, right? It was kind
Right.
of surprising. They also did not, although they tracked it, it's really interesting. They'll note febrile illness, fever, certain symptoms some people did have even after taking the single dose of doxy. But it wasn't measured, it wasn't discussed. It sort of was dismissed. And so I wonder about, the criteria for what they were looking for. It should have also included the symptoms that we know can happen that can happen without the erythema migrans, right? Like the fever, the chills, the new joint or muscle pain, etc. And so it wasn't looking at all that. And the length of time, that observation period that they had, may not have been long enough, even if they were documenting those symptoms appropriately, it may not have been long enough to catch them and then also document and report on and evaluate that. And then just to say, I don't think they were, considering co-infections, obviously,
Right.
but it's important to consider co-infections, right? Now, doxy can, treat Ehrlichia and Rocky Mountain spotted fever and anaplasma. So it may be in this question of, okay, so if we're evaluating a single dose of doxy for Lyme, then we should be looking at these pathogens. However, it's really important to note that doxycycline does not treat Babesia, right? So
Right.
this is carried by a black-legged tick. So a single dose doxy, if you were to take that and if it were to work, it's not going to get to Babesia anyway.
Right.
So what did those people do? And
Right.
any of the viruses like Powassan virus or Heartland virus, etc.
Right. And even though doxy is effective against Ehrlichia, Anaplasma, Borrelia, one dose of it certainly is not suffice. So it's, even though it might be the right medication for most of these infections, with the exception of viruses and parasites like Babesia, a single dose of an antibiotic generally is not enough to properly treat any sort of infection. And then when it comes to the study too, I think interestingly, now it's not like I looked at it right before coming on here. It's been several months, and Alexis, correct me if I'm wrong, but I think like the diagnostic criteria was actually the development of an EM rash. And
Mhm.
we know that that happens only with Borrelia, and it happens less than 40 to 20% of the time when someone has Lyme. So those numbers are pretty dismal. And I think they only followed patients for roughly like a month, and it can take 3 to 30 days for that rash to develop in the 20 to 40% of people that it develops in. So, and also I think there was a very low number of participants in the study too. So there were just so many things that were wrong with that study, and it's just crazy to me that so many medical professionals like just cling to it, probably without ever even reading it or evaluating it. But
Right, right, yeah.
just so important if you are, seeing someone and you've had a tick bite, not to accept this as your treatment. And again, get the tick tested and know what you're dealing with. And then herbs are wonderful as far as, preventing from an antimicrobial perspective, as well as the immune modulating and inflammatory angles that are important to address when you're dealing with an acute infection.
Absolutely.
Okay, so if someone in your family, and we've kind of danced around this, but if someone in your family or you were bitten by a tick, lay out the steps for us. What is the action you would take immediately and why?
Yeah, so first remove the tick as soon as possible. I love my Otom tick twister. I think they work the best. I've mutilated many ticks early on using those tweezers, so that's my method. And then save the tick, right? Find a little baggie or piece of tape or something as soon as you can, just to keep it from crawling away. And then first aid, right? So I use andrographis on tick bites. If you don't have that, you can certainly use at least some peroxide or alcohol. You could use the deer tick bite formula, something that has some kind of antiseptic or antibacterial, more so targeted to Lyme, like andrographis or the deer tick bite formula. Um, Then we're going to note any symptoms, watch for symptoms for the next 30 days, and then start the deer tick bite formula if you'd like. So I created that formula based on work by Stephen Buhner. I know you know very well. And so it has Japanese knotweed, houtunia, cat's claw, and cryptolepis. So these are the herbs that I chose based on their efficacy against that which can be carried by a black-legged deer tick. So those pathogens, it goes after Lyme and Anaplasma, Babesia, Powassan. And so starting that, can be really effective. You take a teaspoon 3 times a day for 30 days. And this way we're not only, killing any pathogens that may have been transmitted, but as you mentioned, there are anti-inflammatory effects, there's immune modulation. It's actually helping your immune system to work better in the face of any of these tick-borne diseases, right?
Exactly.
So yeah, so as you're doing that, looking out and reporting any new rash around the tick bite, any new symptoms, fever, flu-like symptoms, chills, sweats, new joint or muscle pains, new headaches, anything new, of course, report to your medical provider at that point.
Yeah,
So then,
exactly.
yeah, I think, and then, if symptoms were to develop, then we're moving into thinking about, okay, now we're into a symptomatic tick bite, and what is the pathogen and how can we best evaluate that? Is testing appropriate at this point? Lyme testing is not accurate until 4 weeks later, but anaplasma testing is, right? So going through that critical thinking with your medical provider to determine what the best set of action is.
Yeah, absolutely. And I think for a Lyme literate provider, even though you have to wait the 3 to 4 weeks for accurate antibody production towards Borrelia, for example, we can look at shifts in white blood cells and in, the differential of the different types of white blood cells, and we can look at inflammatory markers. There's a lot of things that can be evaluated, early on that isn't relying on the indirect testing, of antibodies. And I also just want to point out too, there's a lot of neuropsychiatric symptoms, especially in kids. So most of the time we're looking for these physical musculoskeletal or pain syndromes to come on. And I just think it's so important, for adults as well as children. But if you see a change in somebody's disposition or their attitude or anxiety out of nowhere, or someone who just starts having panic attacks, like that's not normal. True mental illness, if that's what we want to call it, usually doesn't just come on overnight. So, super important to really be on the lookout for any abrupt change, not just a lot of like these physical and systemic sort of symptoms, especially in kids.
I agree. I definitely see that in children a lot. Yeah,
Yeah.
behavioral changes, personality changes, missing developmental benchmarks. Yeah.
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 So, Alexis, you developed this Preventing Lyme and Tick-Borne Diseases online course. What inspired this? And tell everyone listening about this program that you've created.
Yeah, well, I'm so passionate about prevention and education. And so my book came out, Preventing Lyme and Other Tick-Borne Diseases, a few years ago. And I really wanted to update that and really delve into the information even deeper through the course and provide that for both, patients, lay people, as well as medical providers. I have over 200 journal article references that, I really wanted to kind of bulk up the science behind it, bring in all the evidence and have that for those who are interested. Some of my patients are really interested in that. So, so whether you're interested in that piece or if you just want to be able to learn more about prevention, signs and symptoms of all the tick-borne diseases all over the world. I brought it globally because I was focused on North America for the book. I really wanted to go beyond those boundaries. And, I have patients in Europe, and I was just thinking about, well, gosh, it's gotten me to learn, well, what ticks are there and what are those carrying. And so really being able to provide that information for people all over the world. Um, so yeah, I think it's pretty accessible. I speak in a way, and you get PDFs of all the information. So you can really look at it over and over again if you wanted to be able to understand whatever parts of this that you want to. So yeah, so it's prevention, signs and symptoms, and then treatment, so acute treatments. And then for the medical provider, there's a section also on some critical thinking, thinking through these acute cases, going into chronic just a little bit. But, most of the patients I see do have chronic illness. A lot of us are dealing with chronic illness, and this kind of really focuses in because I think there's not enough out there about, well, how do we really thoroughly treat acute illness? Because if we
Right.
can do that, if we're lucky enough to find that tick bite, and if we had symptoms, unfortunately, if we can really treat this thoroughly right up front, that was really my goal. So people can bring this information to their medical providers. Yeah, so it's about 6 hours of information, and you can go at your own speed, start and stop. It's all online, um, self-study, self-paced. Yeah.
Yeah,
So I
that's
hope it can
great.
make a difference in people's lives. Yeah.
I'm sure that it will. And, for everyone listening, going like, well, I already have chronic tick-borne disease. So how is this going to help me? The chances of getting bit again are pretty high, especially if you haven't really changed all of the risk factors, right? That got you bit in the first place. And unfortunately, there's probably, a loved one that you could help prevent getting this too, if you know how to do the prevention. I can't tell you how many patients we have treated to completion where they're in remission, all of their symptoms are gone, and then we get that call, sometimes within weeks or months of the patient getting bit again. And it's devastating.
Mm-hmm. Yeah, that's what got me into writing the book in the first place. I just had a handout that, got longer and longer
Yeah.
because I'd have patients come back like they were living their lives, feeling good, thriving, and then they got
Yeah.
another tick bite. It's like so discouraging, but we have a lot of resources, and we want to get all that information out to people so that that doesn't happen. Or if it happens, they get on treatment right away, and the right
Right.
treatment.
So, how can our listeners find your program?
Yeah, so if you go to my website, that's a great place to start. So that's dralexischesney.com. DR is in doctor, so dralexischesney.com. And you'll find it, preventing and treating Lyme and tick-borne disease.
And if somebody wanted to work with you, are you taking new patients?
I am at my private office. We have openings, so you can find that on the website as well and schedule there.
Okay, wonderful.
Yeah.
Well, before we wrap up, any final words of advice for our listeners?
Well, I think, so many of my patients can struggle with chronic disease, and it takes a lot to get through it. So I think being gentle on yourself is so important. Self-care is huge, and creating that team of medical providers as well as your team at home, whether it's family or friends or spiritual community, whatever that might be for you. I think it's really, people with Lyme and tick-borne disease need each other, and need support to get through this. So I encourage you not to isolate. I see that sometimes, and I think through COVID, that's gotten worse. This epidemic of loneliness, and I think that can contribute to the challenges of actually being able to heal. So hopefully, people can feel connected through the summit and get some resources. And there are support groups out there as well, whether that's online or in person. There are so many amazing organizations doing amazing work out there. So I'm sure people will learn all about that through the summit. So thank you so much for doing what you do. I'm really glad that the summit is possible.
Well, thank you. Yes, and I think having the support and having the community is crucial. It's crucial in being able to heal. Thank you so much, Alexis, for being here with me today and sharing all of your immense amount of knowledge with everybody. To our listeners, please go to Dr. Chesney's website and look up her online course. And I hope that everything that we have shared with you today helps you on your journey to healing Lyme. We'll see you next time. Thanks, Alexis.
Thank you so much, Mariah. Take care.
You too.